For over half a century, Canada has been a world leader in the production, use, and development of life-saving medical isotopes. The world is counting on Canada to expand this leadership role to support the diagnosis and treatment of cancer, ensuring medical equipment is safe for use, and to tackle some of our greatest challenges in health sciences. Welcome to the Canadian Nuclear Isotope Council's Isotopes for Hope podcast with your host, James Sconiak, Chair of the CNIC. In this series, we interview Canadian leaders who are making a difference every day. We hope you enjoy this episode of the Isotopes for Hope podcast.
Welcome to today's version of our Isotopes for Hope podcast. And with me today, we have Lisa Stevens, and she's the Director of the Program of Action for Cancer Therapy at the International Atomic Energy Agency. Lisa's held this role since 2019, and prior to joining the agency, she spent 24 years in various roles at the U.S. National Cancer Institute, including as Deputy Director of the Center for Global Health. She co-founded the International Cancer Control Partnerships in 2012 with the Union for International Cancer Control and is the Vice President of Women and Nuclear at the IAEA. Thanks very much for joining us today, Lisa.
Thank you so much for having me, James. I'm really excited to talk with you today.
Well, that's great. And we really appreciate you taking the time and all of the great leadership work at the IAEA. Just to maybe start for our listeners, can you really just talk about the Rays of Hope campaign at the IAEA and just give people a sense of how that focus came about and what it's primarily set to achieve?
Sure, happy to. And it's nice to join the Isotopes for Hope podcast series and talk about Rays of Hope. And as we were discussing earlier, there really is a nice alignment between the two initiatives. So Rays of Hope was launched in February of 2022 with the aim to improve access to radiotherapy. Our Director General, Rafael Grossi, noted that there were many countries that had no access to radiotherapy. And so under the program umbrella of Rays of Hope, we wanted to engage with countries who wanted to either initiate radiotherapy or expand access to radiotherapy and diagnostic imaging, really with the aim to improve cancer outcomes for low and middle income countries by providing this comprehensive access to radiation medicine. And we talk about radiation medicine as radiotherapy, diagnostic imaging, and nuclear medicine. Since the launch, so we're, 3 years ago, more than 90 countries have joined the effort to have this opportunity for more equitable access to radiation medicine. We realized under the leadership of the Director General that something different needed to be done. The agency has been supporting its member states for over 6 decades in the use of nuclear technology in the health space, so particularly in the cancer space. But we really needed to organize slightly differently, working more in parallel, working across multiple departments at the same time, because we know that cancer incidence is rising. And with one of our key UN partners, the International Agency for Research on Cancer, their Global Can data shows that year on year, there's more incidence and more mortality from cancer. So under Rays of Hope and as part of the work that my division, the Program of Action for Cancer Therapy, does, is we support baseline assessments of a country's cancer care capacity. And we do this in collaboration with other UN organizations, the World Health Organization, the International Agency for Research on Cancer. We support these assessments. We can also support procurement of equipment. We support capacity building and training. We really want to enhance our collaboration with countries. We want to provide scaled up support by actively building partnerships with countries. And also we want to ensure sustainability. And we have anchor centers as part of this sustainability plan. And I can talk about that as we go forward.
Well, Lisa, clearly really important work, and I'm fully in agreement with you that I think there's good alignment between the work of you and the Director General and everybody who's signed on to Rays of Hope with what we're doing for Isotopes for Hope here in Canada. And we're really excited about the opportunity for Canada to contribute to that global effort. Lisa, we recently celebrated in Canada, I think it was our 73rd anniversary, cobalt therapy treatment in London, Ontario. And that's something we always celebrate in Canada. There's a stamp from that year that was a real sense of national pride. But as I look at the work you're doing, I'm reminded there are literally hundreds of millions of people. I like to get your sense of understanding kind of the number of people around the world that are impacted by your program. But there are literally hundreds of millions of people in the world that don't have access to that cancer therapy that we had in Canada 73 years ago. And to me, that is a reminder for humanity that we have a lot of work to do. And so, Lisa, for our listeners, can you put this in perspective for people? Like if we thought about it from the point of view, and you'll think about the right terminology, but if I thought about the number of people, what levels of world population are we talking about that you would look at as, under service to no service when it comes to, cancer diagnostic or therapy?
Right. So we just updated our radiotherapy access map using the data that the agency collects on available machines. So it's the DIRAC database available at IAEA, and comparing it to the GlobalCan, so the global cancer incidence. And if we focus in specifically on Africa, where there is rising incidence of cancer, about 90% of the 1 billion people in Africa do not have access to radiotherapy. And again, the technical staff at IAEA envision that 50 to 60% of all cancer patients would be indicated to have radiotherapy at some point during their treatment. And so you're talking about half of the cancer population in a continent that will not be able to access this life-saving or palliative service. So that the numbers are dire. There really is a need for this concerted effort, these partnerships, in order to bring cancer care to countries.
So clearly, there's a human imperative to do the right thing here. And as we look at it as Canadians, there's no doubt there's a tremendous opportunity for us to contribute to that success through the production of reliable medical isotopes, deployment of equipment, and many of the areas that you are spearheading at the IAEA. What Lisa is what are the biggest barriers? Is this primarily an economic barrier? Is it a technology barrier, a human resource barrier? Like maybe you can just describe for our listeners, what are some of the key barriers that you're trying to break down? I mean, those numbers are staggering, to me, hundreds and hundreds of millions. So just in the continent of Africa alone, more than the population in North America.
Correct. You mentioned a lot of the challenges. So I think one is on this global rise in the burden of cancer. And we really have to look at how can we scale resources. We need to look at the investment in cancer care. And I think it's often seen as a cost rather than an investment in a healthy population. Radiotherapy is also a cost-effective treatment. And IAEA wants to ensure that there is access to safe, reliable, and quality treatment. One of the ways that we're overcoming in terms of the scaling and helping countries, especially if they do not have a radiotherapy center, is by helping them to craft what we call a bankable document. They're techno-economic feasibility assessments that are member state owned and technically reviewed and validated by the IAEA. So there are technical elements to these documents as well as financial elements, and they're built and developed to bankable standards. So a country, a member state, can take these documents to investors, to private sector, to international financial institutions. There have been countries that have used them internally to secure national resources for the initiation or expansion of radiotherapy. So we have countries like Zambia, the Democratic Republic of the Congo, Malawi, that have used bankable documents to either set up their first radiotherapy center or to expand. So it is one tool that can help to overcome this challenge of how do you scale up to meet the rising demand. Another challenge is to assure sustainability. So a lot of effort can go into the training, the procurement, the building of facilities for radiotherapy and diagnostic imaging. And we want to make sure that once that center is open, that it stays open. And under Rays of Hope, we have anchor centers. And so these are institutions that have been working for a long time with the IAEA. They have the capacity to take on some additional training courses for regional participants, for medical professionals that would come to one of these anchor centers, these regional hubs, in order to have a specific type of training. And the anchor centers can also provide experts to serve on quality missions, going out into the region, again, to make sure that the care that's provided meets certain quality standards. And they can join in on innovation, so research and development, to support further advances. So, there are a lot of challenges. You mentioned some, but I do think the scale and the sustainability are some of the key challenges.
So, Lisa, if I think about, maybe I'll take one of your regional centers as an example. Clearly, cancer is there's many different types of cancer, many different types of treatments for cancer. How should we think about where to start? There's a wide range of treatments, some that are, relatively speaking, in terms of North American standards, very, very low cost. And then there's other cancer treatments, which we know for a whole series of reasons are high cost. And I hate when we're talking about human lives to raise those items, but unfortunately, those are some of the realities. How should we think about, if you have a population that is so underserviced in cancer treatment, what types of treatments do you typically start with? Like, what's the best sort of bang for your buck on helping the most number of people for the lowest cost? And when I hear what you talk about with human resources, also with a reasonable degree of complexity to really start building that capability.
Right. So this is a big question. So my answer might be a little bit longer. I want to go back to some of the core work that we do in the division of these country level assessments. And even though the agency has a technical mandate for radiotherapy, diagnostic imaging, and nuclear medicine, but we partner with the World Health Organization and the International Agency for Research on Cancer so that we can go across the whole cancer care continuum. So we can look at cancer registration and prevention, screening, diagnosis, all the imaging aspects, surgery, access to medicines. And then there's a list of evidence-based recommendations that the international experts, along with the national experts, there's a document that's created, and the country can then use this to plan and prioritize, because you're asking really about planning and prioritization. And that would be, for example, a national cancer control plan, where a country can say, we looked at the highest burden of cancers. What is this country facing? Is it cervical cancer? Is it gastric cancer? For women, is it breast cancer? What are those high burden cancers, and what are some of the interventions that are needed? If you've already got a high burden of late stage cancer, you're probably not going to set up a screening program. You're going to look at how can we make sure that there's accurate diagnosis and that these patients are able to get timely treatment. That being said, there are also the global initiatives that the WHO has led, and IAEA is a strong partner in those, participating in looking at how do we integrate our technical areas into those global initiatives. And if I just think of the cervical cancer, the 90% vaccination, 70% screening, and 90% access to treatment, IAEA's work really fits into that 90% access to quality treatment pillar. And so it's, starting with vaccination, that's great, but you're not going to see a change in the trajectory of cervical cancer for many, many years. So what are you doing to both detect in the population pre-invasive or invasive disease? And then how are you helping those women who have invasive cervical cancer to be able to have life-saving treatment. So it's hard to say, one area over another to start with, but to really look at it on a system level and making sure that anytime you're setting up a screening program, there is access to diagnosis and treatment.
So, Lisa, one of the things that I have to tell you on behalf of the Canadian Nuclear Isotope Council that I'm super excited about, and I know we had the chance in late 2024 to meet in person at the IAEA headquarters in Vienna with you and your team, is the advancement of an MOU that we have underway between the CNIC and your organization. I'm super excited about that for a whole bunch of reasons. I often say that the world is counting on Canada. I mean, the world's clearly counting on everybody to do their part, but from an isotope perspective, we historically as a country have been a world leader in this space, and I think it's important that we're part of this work that you and the Director General and the IAEA are leading. Can you talk a little bit about the MOU with the CNIC and how that fits in, Lisa, with the strategic work and goals that you and your colleagues are advancing through Raise for Hope?
Sure, James, and I'm excited by your enthusiasm, and I could really see that during the event that you hosted during the ministerial conference. And I think because of your enthusiasm, one of the primary, or at least the first thing noted in the MOU, is to collaborate on advocacy. And I think that the strong partnership between IAEA and CNIC to talk to governments, to other partners, to industry, to non-governmental organizations, really about how important isotopes are in many cases of cancer. What are the possibilities in low and middle income countries, either to integrate the isotopes into their care setting, or perhaps even to become their own producers. But, there's a lot of potential there. As you mentioned, the leading expertise of Canada in isotope production, I think is just going to be able to benefit our member states as we decide, how do we implement this memorandum of understanding to strengthen capacity for diagnostics and treatment. To build on and tap into the connections that you already have in the Canadian nuclear and medical sectors, I think will be important. And it's, just perhaps an untapped resource for us at the agency. And to utilize that network that you have across industry, the public sector, and regional institutions. And then again, it's a little bit repetitive of the advocacy part, but really to engage with different ministers within the Canadian government to talk about what the partnership with IAEA is, raising that awareness and the support through technical cooperation and development that's possible under this partnership, within the various sectors. And I think, we have a variety of communication channels between your organization and ours. And thinking back to the event that you hosted at the ministerial conference, you had two panelists from a different division here within the agency, the Division on Physical and Chemical Sciences. And they were also very enthusiastic about the partnership because this is their area of technical expertise. And we've talked a little bit about the other director and I about how to incorporate their work on radiopharmacy more front and center into Rays of Hope, and our enhanced support to member states. So I really do think that this part, the signing of the MOU is really just the first step in strengthening this partnership, really to the benefit of the countries and to cancer patients.
And Lisa, the biggest learning for me, as I've been learning more about the outstanding work underway with Race for Hope is, I think we would all agree that that access to any type of healthcare, there's financial challenges everywhere. I mean, here in Canada, throughout the world, the biggest learning that I've taken away is that there's also a lot of work we can do that is not necessarily all financial based. There's items that training, there's practices, there's technology that a lot of countries that have become used to this kind of cancer diagnosis and treatment could provide to the program so to really help people around the world, and that's at no cost. Those are areas that have already been invested in, and it's really just a moral imperative to make that available. And I'm always a big believer that when you have a challenge, not you, we have a challenge. It's all of our challenge if with some of these numbers that you've talked about, and just take Africa as an example, that's a shared challenge. But if all of us do our part and we find what contribution makes sense, how can we make that contribution? I think it's safe to say this is a problem that we can make a very substantial dent in and deal with.
And I think, just to build on that, there may be activities that you're already engaged in, so it wouldn't necessarily be anything new. But it's, like, how is there some enhanced coordination so that we can, work smarter, not harder, not just add things to add things, but see what we're doing and how we might be able to build on existing activities.
So, big picture here. Just to sort of wrap up, Lisa, what are some of the biggest challenges that you see out there? We have a rapidly changing world. We have there's a lot of geopolitical dynamics, a lot of issues. How do those externalities impact the broader goals you have on improving global cancer care? Because you really have a North Star, right? And you're trying to maintain a focus on that. What key messages should people who are listening take away in terms of what can they do to help, and what responsibility do we have as just everybody live on the same planet together and care about each other? What is it you really need to continue to be successful and advance towards that North Star?
I think that collaboration is really the key. And you mentioned, sort of the time we're in right now, that it's not any one entity's problem, and it's not any one entity's solution to find. So it's really building these networks, these coalition of partners. We've been reaching out over recent years to really diversify our engagement. So we have some very supportive member states who contribute financially. And our Director General said, we need to tap into the private sector, into non-governmental organizations. There are potential opportunities with international financial institutions. And I really do think over the last, let's say, decade, with the 2011 high-level meeting on non-communicable diseases, looking at some countries that have crossed over from the communicable disease burden into non-communicable diseases, that there is a need for us to work collectively to look at health systems and to really, not just rely on the Ministry of Health, but it's, health, it's education, it's science and technology. It's a whole of society solution to a whole of society problem.
Well, and Lisa, one of the things I often say when we talk about this important topic here in Canada is that in our lives, 40% of us will get cancer in Canada, but 100% of us will be impacted by cancer, whether it's ourselves, our loved ones, our colleagues, our friends, our neighbors, and we should all be seized with the issues you're talking about. And it's sad to think that there's technology that has been available for 70 to 80 years on the planet Earth. And when somebody gets cancer in some of these countries that you're talking about, they don't even have a shot at treating it. And that's not a good outcome for them. And frankly, it's not right. And so I do think we all have a moral imperative to all do more. And I think if we all collectively do more, we'll all be, stronger for that. Look, Lisa, I want to thank you very much for joining us today. I would encourage our listeners to visit the IAEA website. They do have a whole section on Raise for Hope. It's a fantastic background. I think that radiotherapy access map, I have to tell you, Lisa, it's impactful. It really puts it in perspective. And what I would always challenge us to do is when we see the numbers that Lisa and her people are talking about, remember every single one of those numbers is a person. It's a son, it's a daughter, it's a loved one, it's a community member. And we can never forget that there's people behind those numbers. So Lisa, thank you very much to you and your colleagues for everything that you do. Also, kudos to the Director General. I know this has been a real focus of his. And I would say without that leadership, I think we would have a major, even more of a global gap than we do. So the work by you and him and your colleagues is really important. And I'm super excited to enter into this MOU that we will be in the near term and doing what we can to make a difference. So thanks very much for joining us today.
Thanks a lot, James.
Thank you for listening to this episode of the Canadian Nuclear Isotope Council Isotopes for Hope podcast with James Sconiak. Please share this podcast and follow us to stay in the loop. To learn more, please visit our website at canadianisotopes.ca.